Delhi. Let's go live to that city now and talk to Narendra Taneja, spokesperson for the ruling BJP party. Good evening. Thank you for being with us. I mean, this is clearly a humanitarian tragedy unfolding here, but isn't it also a political disaster for your government? People dying waiting for beds, people dying waiting for oxygen, people dying on mattresses outside hospitals, and people dying because they have not been vaccinated. That is a failure of government, isn't it?
Well, there are challenges in some parts of the country, especially in cities like Delhi and also partly in Bombay and a few other places, especially when it comes to oxygen, shortage of beds, and also in some cases even shortage of medicines. And as you know, health is a state subject. The respective states are handling the situation to the best of their capacity and capabilities, and fully assisted by the central government in New Delhi. Like the video that you were just showing, the report was from New Delhi, which, as you know, is not ruled by the ruling party, but nevertheless is the national capital, and the central government is trying its very, very level best, and there is some improvement. There is no shortage of oxygen. The area where we are facing a huge challenge is bringing that oxygen from plants to hospitals and to those who need it. So, but that's being addressed, and we are quite hopeful that in the coming few days, this particular issue would be addressed.
Right. Well, you say it's a state responsibility, but you were very happy to claim success when the first wave was dealt with. You passed a resolution saying it can be said with pride that India defeated COVID-19, and then you said, under the able, sensible, committed and visionary leadership of Prime Minister Modi. So if he's claiming the successes, why doesn't he admit when things go disastrously wrong?
Well, first of all, the Prime Minister didn't claim anything of that sort. There have been some articles, I've seen the one especially in the London Times, but there was a political meeting of the ruling party, our party. Their resolution was volunteered by some delegates, and some delegate decided to go ahead with it. That was it. So it was not any kind of resolution on the part of the central government or the Prime Minister office or Parliament or anything of that sort. That was a political meeting where some enthusiasts, they passed a resolution. But as far as the country is concerned, we have been fighting with it with full force and with tremendous success in most cases. But this particular, the second wave has come like a tsunami. And as you know, tsunami, whenever a tsunami happens anywhere in the world, that has, of course, internal elements, our preparation, but also external elements.
But do you expect, sorry to interrupt, do you accept that many of the deaths could have been avoided if different political decisions had been taken, if you hadn't opened up so early, if you hadn't held massive rallies in West Bengal, if you hadn't had a big Hindu festival, allowed that to go ahead where millions gathered?
No, you see, first of all, those political rallies in West Bengal that you're referring, mostly those rallies were in the rural areas where, pandemic has not been an issue. And at the same time, when it comes to religious congregations, the moment the government got to know about it, the government appealed and they immediately decided to call it off. But that was religious. Government has absolutely nothing to do with that particular festival you're referring to. Religious one has been going on for the last 7,000 years. That's decided by the Hindu priests.
Not during with respect, of course it has, and it's a very important festival, but not during a COVID pandemic.
Well, I take your point, but at the time when it was, they received the go-ahead and they decided to go, at that time, there was no second wave on the horizon. I mean, not only this thing, the central government or various state government or health authorities or hospitals, I mean, nobody could see that on the horizon, including media, including BBC. You have got a big, big office in New Delhi. Could they see it? No, they couldn't. Sky in Delhi, they could see it? No, they couldn't see it. So we couldn't see it on the horizon. It came like a tsunami. And hit it very hard. We accept it. But at the same time, now what we are doing is mobilizing every single possible resource in order to meet this challenge. And we're quite confident, we will, meet this challenge and come out of this, defeat COVID and come out of this, in pretty good shape.
Okay, do you seriously believe that the case numbers and the death numbers that are being reported are correct?
Well, right now, you see what our focus is on providing help and medical assistance to those who need, not really counting the numbers. Of course, the government is keeping an eye on that, various agencies, but once we are out of all that, there's going to be kind of numbers being reported by different media outlets and all that, but there will be kind of complete reconciliation so that, future preparations can be based on that. But right now, the focus is on mobilizing maximum possible support for those who need their support, including oxygen.
Okay, I understand. The scientists, though, are saying the numbers are wrong. One epidemiologist who says, Brahma Mukherjee, he says, from all the modelling we've done, we believe the true number of deaths is 2 to 5 times what is being reported.
Well, it's quite, you see, the same people, they did modeling also 1 year ago, last April, last May. And they said X number of people are going to lose their life in India and so on and so on. That didn't happen. I mean, sitting in Washington, D.C. at their lab and doing this number crunching is their job. I respect that. But at the same time, you have to see reality on the ground. We are the government. We are the political party. We are the people here. We are seeing the situation on the ground. And we are you have seen already this tremendous improvement in the state of Maharashtra. Second wave, we started from Maharashtra, and we see the improvement there the last 10 days and all. We are pretty confident we will see similar improvements in other parts of the country very soon. We know the country, we know our infrastructure, but they can do their number crunching and, you can buy the numbers. But we are going more by the ground reality here in India. And we are quite capable of our own, capabilities. And we have experienced similar situation in the past, not necessarily COVID, but other kind of natural disasters and so on and so forth. So as a country, we have tremendous, resilience, and we are very confident we'll come out with the support of the people of India. Right now, our challenge is to address and mobilize medical support. Those who are busy with the numbers, I respect that. But right now, our focus is on how can we save lives, how can we mobilize oxygen, how can we expand, our hospitals' capacity, number of beds, and so on and so forth.
Mr. Taneja, we have to leave it there, but it is a challenge like no other that you faced recently, certainly. Thank you very much indeed for being with us. Appreciate your time.